Bonjour. Thanks so much for being here. So I want to begin by talking about my call with the Prime Minister yesterday. We reiterated exactly what we've been asking for from before, and that is we are in a third wave. Things are very bad. We've got numbers on the rise across the country, record number of cases in Ontario, field hospitals are being set up, and we've got ICU units that are being overrun. Given all of this, the priority has to be in getting people vaccinated. We just heard recently that 10,000 appointments were canceled for vaccination because of a lack of supply in Toronto. And these were for the hard-hit communities that had low rates of vaccination and higher rates of infection. So this is very serious, and why we again call on Justin Trudeau to make it a all-hands-on-deck approach to getting everyone vaccinated, securing more doses, but also helping with the delivery of those doses. One, and two, that paid sick leave is vital, it's fundamental. Workers are getting sick. Workers are getting sick at their workplaces, and they're going into work because they have no paid sick leave. They're going into work sick. We need to make sure we've got better paid sick leave. There's a federal program. It needs to be improved. So those are the two things we ask for and continue to push for. We need help to people. Donc, on est dans une troisième vague de la COVID-19. Ça frappe fort et on a besoin d'aide. On a vu des nombres records des cas de la COVID-19 en Ontario et les nombres augmentent à travers le pays. Donc, ce qu'on doit faire dès maintenant, et ce que j'ai dit au Premier ministre Justin Trudeau pendant notre appel hier, c'est qu'on doit améliorer la livraison et la sécurisation des vaccins. Ça, c'est essentiel. Et ce n'est pas suffisant de seulement laisser les bras comme OK, ils vont fonctionner si on sécurise la dose. Non, on doit aussi jouer un rôle comme gouvernement fédéral pour aussi aider dans la vaccination. Deuxièmement, un programme de congé de maladie payé, c'est essentiel. Et jusqu'à ce moment, ce qu'on a dit, c'est que notre programme fédéral qu'on a lutté pour créer a des problèmes, on doit l'améliorer et on doit le faire tout de suite. Donc, ce sont les deux demandes que j'ai soulevées hier. Je continue de mettre la pression parce que c'est important et je suis prêt pour vos questions. I'm ready for any questions you might have.
We'll now start the question period. Nous allons maintenant débuter la période de questions. Un petit rappel, une question de suivi, one question, one follow-up. Opérateur, avant nous, une première question.
Merci. La première question vient de Catherine Lévesque de la presse canadienne. La parole est à vous.
Oui, merci beaucoup. Bonjour, M. Singh.
Bonjour.
Est-ce que vous avez eu des engagements de la part de M. Trudeau hier après-midi au sujet de choses là, que vous voulez voir dans le budget et puis qui pourraient faire en sorte que vous allez voter pour ce budget?
On a parlé de l'importance de le service de garde et les investissements dans les services de garde. On a parlé de ça depuis longtemps. On a dit que dans cette pandémie, les femmes étaient frappées fort par la pandémie. Et c'est un temps tellement difficile. Ils ont besoin de prendre soin de leurs enfants et aussi prendre soin de leurs proches plus âgés. Donc, c'est beaucoup de responsabilités sur les épaules des femmes. En plus, on a vu une grande perte des emplois. Donc, on a exigé le gouvernement de livrer plus d'aide pour les services de garde. Donc, je pense qu'ils ont déjà mentionné à quelques reprises que peut-être ils vont livrer quelque chose pour aider dans ce domaine. Donc, ça, c'est une nouvelle qui me donne un peu d'encouragement. Mais on a vu souvent avec les libéraux, il dit une chose et il fait une autre chose. Donc, je reste cynique, mais je garde mon optimisme. Donc, aussi, j'ai dit que c'est essentiel de prioriser la vaccination et l'amélioration d'un programme de congé des maladies payées. Donc, ils étaient ouverts dans la discussion, mais pas des engagements concrets.
OK, donc juste pour être clair, vous restez optimiste que vous allez pouvoir voter pour ce budget, si je comprends bien. Et j'ai juste une autre question sur un autre sujet. Tout à l'heure, il y a le Bloc québécois qui va tenter de réintroduire son projet de loi sur le rapport d'impôt unique au Québec. On sait que le NPD avait voté, là, en fait, en gros, le NPD s'était rangé du côté du Bloc québécois en comité fédéral. Je me demandais si le NPD va voter là, pour réinstaurer chaque amendement du projet de loi là, qui a été vidé de son contenu en comité. Ça va se passer tout à l'heure après la période des questions.
Merci pour la question. Donc, on a soulevé notre grande inquiétude, c'est la menace d'une perte des emplois. Et jusqu'à ce moment, il y a toujours une menace des pertes d'emplois avec cette proposition. Et j'ai parlé avec les chefs des syndicats qui sont touchés par cette question et ils ont soulevé cette inquiétude parce que leurs membres peuvent perdre leur emploi. Et pour nous, ce sont des régions qui sont déjà défavorisées, qui ont moins de travail, moins des emplois. Donc, une perte des autres emplois va être un dommage terrible pour ces communautés. Donc, ça, c'est mon inquiétude primordiale, la potentielle perte des emplois. En général, l'idée de rendre le système de fiscalité plus simple pour tout le monde, c'est important. Mais je continue d'avoir des craintes par rapport aux emplois.
Merci. Opérateur, avons-nous une prochaine question?
Il n'y a pas de questions à ce moment. Je vous retourne la parole.
Parfait. Donc, question in the room?
Stephanie Taylor with the Canadian Press. Thank you very much,
Hey there.
Mr. Singh. Given the concerns about the vaccination rate in this country and the limited supply, do you think the federal government should start taking vaccines sent to regions that are less hard hit, so for example, Atlantic Canada, and diverting them to places like Toronto or other jurisdictions that are seeing much higher rates?
I appreciate the question. The general concept, I absolutely agree with the concern around that with the rate of vaccination, it's not just the rate, it's about who's getting vaccinated. And in Toronto, for example, the recent reports show that some of the wealthier communities that have the lowest rates of COVID-19 have the highest rates of vaccination. And the poorer communities that also have the highest rates of infection are amongst the lowest rates of vaccination. So clearly, there is a mismatch there where communities that are harder hit are not being prioritized with vaccine dosage and vaccination, frankly. So that is a problem, and we need to make sure our efforts are directed towards where the biggest risks are, where most people need the help is where we should be directing the help. That is a general principle that I support. I haven't weighed in terms of regionality, but in terms of within a city, absolutely, there's no doubt that we need to prioritize the communities that are hardest hit. And so looking at that at a global or looking at that at a national scale, we should apply the same metric that following public health guidelines, getting the vaccine dose and vaccination to the communities that are hardest hit makes sense so that we save lives. Really, the goal has to be whatever we do, the question we have to answer is, will this save more lives? Will this help more people? And if we can answer that question, we should follow with that type of course of action.
Thank you. I want to talk about fossil fuel industry workers for a minute. You disagree with Ottawa's purchase of a pipeline, and you talk about the need for a green transition, yet that threatens the jobs of workers in this sector. Meanwhile, you have the Conservatives that want to build more pipelines and expand this sector. Why shouldn't these workers throw their support behind Mr. O'Toole?
First of all, I want to take a moment to reflect on the reality that these workers are going through. Through no fault of their own, we've got resource sectors across Canada, and particularly in provinces like Alberta and Saskatchewan, who are being hard hit because of the international volatility of commodities. It is no fault of their own. They've lived through this in the past with bust and boom times. We know that right now, with the direction that the global markets are headed in, with major automobile manufacturers indicating that they're going to end the production of fossil fuel combustion vehicles, there is clearly a shift going on where there will be less demand. That means we need to do more than ever focus on how we help resource energy and resource sector workers. We have to help these workers with good jobs now, not in a distant future, not a vague promise. We need an immediate plan to put workers to get workers to work. So that's why we're calling for similar things like initiatives where we enhance the remediation of abandoned oil wells to immediately get workers to work. We need to have a plan that's not a distant, vague plan, but we need a plan right now. And workers deserve a job that will be there for now and forever, not just in the short term. And it is folly for parties like the Conservatives to not make decisions that will invest in a long-term sustainable future for workers. That's what we want to see happen. We want to see real jobs, concrete jobs right now and for the future. And we want to make the right investments to create those jobs.
Merci. Opérateur, nous allons vérifier encore au téléphone. Avez-vous des questions?
Il n'y a pas de questions à ce moment. Je vous retourne la parole.
I think we have more questions in the room.
Thanks again. Do you support the Conservatives in making PPE tax deductible for workers, or would you want to go farther and say reimburse workers for purchasing PPE?
We need to make it as easy as possible for a worker to get protective equipment. So really the goal should be for workers to be safe. That should be a part of their job. They should not have to shoulder any burden for that. We should make it so that it's easy, it's accessible, there's no barrier, there's no burden, and we need to support people staying safe. So for us, the maximum amount of help possible to keep workers safe should be something that is a part of their employment. They shouldn't have to bear out-of-pocket expenses to stay safe. We want to make sure we've got the type of protections in place that workers are guaranteed that. They go into work safe and they come back to home safe. That's really the New Democrats' values. We've consistently fought for better protections to keep workers safe and that they can return home safe. That is vital, and that includes in this pandemic and moving forward. There should be no cost or barrier to being safe.
As well, going back to vaccinations, what specifically should the federal government do about where vaccines are being rolled out, given that this is clearly a provincial jurisdiction matter? Like, are you kind of advocating that they overstep that jurisdictional boundary and just start doing the vaccinations themselves, or direct the province as to how to do it?
And this is a really big question. Lots of people have been raising this really important question. And the way I look at it is this: we are in a crisis. And in a crisis, it is not good enough to just sit back and be passive. It is not my position that we in any way overstep boundaries, but we can't be in a crisis and not respond with the same seriousness proportional to how bad things are. Things are bad right now. Our country is on fire with COVID-19. The cases are increasing, things are very scary, and people are frustrated. So we need to have a federal government that's playing an active role. And right now what I'm seeing is the federal government is kind of passively offering help, but not actively involved in saying, well, here's a way we can get more help to people. We need to consider, if you've got a factory that's got massive infections, why don't we have a mobile vaccination center set up right in front of a massive factory or warehouse so the workers get immediately vaccinated? Why aren't we going door to door in communities where they're hard hit and getting people vaccinated? Like, it does not feel like the response, we're in a crisis, but the response doesn't feel like a crisis. And so I don't feel like this is what I would expect when things are this bad, that we don't have the immediate on the ground response necessary. And sure, there's going to be some challenges to do this, but in a crisis, I feel like this is the time we figure that out, and we do whatever possible, leave nothing on the table, like leave nothing behind. We do every single thing we can to get people vaccinated. That's the approach I want to see, the urgency that I feel and I want to see reflected in the actions. And I don't feel that that's the urgency I'm seeing with the federal government. It's not that urgency. Let's do something right now. Let's save lives. Let's get people vaccinated. I'm not seeing that.
Thank you, Operator. One last time on the phone. Is there any questions?
Il n'y a pas de questions à ce moment. Je vous retourne la parole.
Perfect. This concludes the press conference. Merci.
Thanks so much. Appreciate it. Merci.